My name is Larisa Geskin. I am a professor of dermatology and internal medicine at Columbia University, and I am a director of Skin Cancer Center at Columbia. And I've been treating CTCL patients for my entire career, almost 25 years. The CTCL is extremely challenging to diagnose. In fact, some studies show that the delay between onset of symptoms to diagnosis may be 3-4 years, and some publications up to 8 years and even longer. So some patients may have this disease that is incurable and difficult to treat and may not even know it. And the reason that it's so difficult to diagnose is because it can look like common rashes like eczema or psoriasis, and doctors may be mistaken by looking at this. They may not think about that the patient may have cutaneous lymphoma, and it's a truly challenge to arrive to diagnosis on time. Well, it's unlikely that primary care will make this diagnosis because very few primary care are even aware of it, and this is one of the obstacles to the diagnosis. Usually, the dermatologists who try many different treatments over the years all of a sudden may think about this. Maybe it is CTCL, maybe I need to biopsy it. The challenge is that even if you biopsy, it doesn't necessarily give you the diagnosis because the biopsies can also be what we call non-specific. It can show features of benign dermatosis, such as eczema or psoriasis. And unless that biopsy is looked at by a professional dermatopathologist who is a specialist, the diagnosis can easily be missed even on the biopsy. So there are several things that we are working on to try to arrive to diagnosis earlier. One of the main things in arriving to diagnosis early is actually quite simple. It is to think about it. If you think about diagnosis of cutaneous lymphoma, then you will go along that path of diagnosis. And the path of diagnosis may not necessarily be you see the rash, you do the biopsy, and you arrive to diagnosis. As I explained earlier, the biopsies may be non-consistent, non-specific, and we may need to repeat those biopsies time to time to eventually arrive to diagnosis. But what's important is that when you think about this diagnosis, then you may consider treatments that may not be harmful. And that's the main thing. So if you treat this condition as benign dermatosis, some of the drugs that we use are actually harmful or may be harmful to cutaneous lymphoma patients. And so it's very important to think about cutaneous lymphomas when you treat these diseases, especially with the systemic drugs such as TNF alpha inhibitors, maybe Dupixent, maybe some other antibodies that we use, or some other chemotherapy agents like cyclosporin, for example. It's extremely important to avoid those things that may be harmful if you think the patient may have cutaneous lymphoma even before diagnosis.